Chronic atrophic rhinitis is a chronic inflammation of nose characterized by atrophy of nasal mucosa, including the glands, turbinate bones and the nerve elements supplying the nose. Chronic atrophic rhinitis may be primary and secondary. Special forms of chronic atrophic rhinitis are rhinitis sicca anterior and osorrhea. Primary atrophic rhinitis. History: this disorder was known since the time of ancient Egypt, almost 4,000 years ago, and descriptions of it are found in the historical medical papyri. In the Edwin Smith papyrus it was prescribed a treatment based on wine and breast milk to cure this disease. Even the ancient Greek civilization and the Indian were aware of atrophic rhinitis. Etiology: hereditary factors. The disease runs in families. Endocrinal imbalance. The disease tends to start at puberty and mostly involves females. Racial factors. Whites are more susceptible than natives of equatorial Africa. Nutritional deficiency. Vitamins A or D, or iron. Infection. Klebsiella osorrhea, dithyroids, Proteus vulgaris, coli, etc. Autoimmune factors. Viral infection or some other unidentified insult may trigger antigenicity of the nasal mucosa. Pathology: the ciliated columnar epithelium of the nasal mucosa is replaced by stratified squamous epithelium. Atrophy of mucosa, turbinal bones and ceremuccinous glands tends to occur, due to obliterative endarteritis causing decreased blood supply. Hence the supplying area atrophies. Arrested development of paranasal sinuses. Clinical manifestations most commonly seen in females. Reported among patients from lower socioeconomic groups. The nasal cavities become roomy and are filled with foul-smelling crusts which are black or dark green and dry, making expiration painful and difficult. Microorganisms are known to multiply and produce a foul smell from the nose, though the patients may not be aware of this, because their elements have become atrophied. This is called merciful anosmia. Patients usually complain of nasal obstruction despite the roomy nasal cavity, which can be caused either by the obstruction produced by the discharge in the nose, or as a result of sensory loss due to atrophy of nerves in the nose, so the patient is unaware of the airflow. In the case of the second cause, the sensation of obstruction is subjective. Bleeding from the nose, also called epistaxis, may occur when the dry discharge are removed. Septal perforation and dermatitis of nasal vestibule can occur. The nose may show a saddle nose deformity. Atrophic rhinitis is also associated with similar atrophic changes in the pharynx or larynx, producing symptoms pertaining to these structures. Hearing impairment can occur due to eustachian tube blockage causing middle ear effusion. Permanent loss of smell and impairment of taste may also be a result of this disease, even after the symptoms are cured. Secondary atrophic rhinitis. Specific infections, such as syphilis, lupus, leprosy and rhinoscleroma, may cause destruction of the nasal structures leading to atrophic changes. Atrophic rhinitis can also result from long-standing purulent sinusitis, radiotherapy of the nose or excessive surgical removal of turbinates. Unilateral atrophic rhinitis. Extreme deviation of nasal septum may be accompanied by atrophic rhinitis on the wider side. Treatment options. Treatment of atrophic rhinitis can be either medical or surgical. Medical measures include nasal irrigation using normal saline, nasal irrigation and removal of crusts using alkaline nasal solutions prepared by dissolving a spoonful of powder containing 1 part sodium bicarbonate, 1 part sodium biborate and 2 parts sodium chloride. 25% glucose in glycerine can be applied to the nasal mucosa to inhibit the growth of proteolytic organisms which produce foul smell. Local antibiotics, such as chloromycetin, vitamin D2, estradiol spray for regeneration of ceremuccinous glands and vascularization of mucosa. Systemic streptomycin against Klebsiella organisms. oral potassium iodide for liquefaction of secretion, placental extract injected in the submucosa. Surgical interventions include Young's operation, modified Young's operation, narrowing of nasal cavities, submucosal injection of Teflon paste, section and medial displacement of the lateral wall of the nose, transposition of parotid duct to maxillary sinus or nasal mucosa,